story this morning. A deadly disease has appeared for the first time in the U.S. It's called Middle East Respiratory Syndrome, the MERS virus for short. The Centers for Disease Control says MERS turned up in Indiana, where one patient recently back from Saudi Arabia is being treated.
Until now, the virus has been seen only in the Middle East and Europe, a dozen countries in all. About 100 people have died from it. Here's Dr. John LaPook.
The unidentified patient was a healthcare worker in Saudi Arabia. On April 24th, he flew from Riyadh to London and on to Chicago, then took a bus to Indiana. 3 days later, fever, cough, and shortness of breath developed. The next day, he was admitted to Community Hospital in Munster, Indiana. The patient's travel history led the state's public health department to test for MERS. Dr. Ann Schuckett is with the CDC.
We were working with partners in England and with others around the world to make sure that the people who were on the airplanes are contacted and notified to be on the lookout for signs or symptoms.
The MERS virus was first reported in 2012 in Saudi Arabia. There are 401 known cases worldwide with 93 deaths. All the cases can be traced back to the Arabian Peninsula. Those 6 countries have 88 of the deaths.
The treatment for these patients is symptomatic and physiologic. We take care of them. We watch their breathing. We may assist their breathing. We watch their urine. We give them appropriate intravenous fluids. We monitor their kidney function and the like. But at the moment, there's no specific antiviral drug that we have available to treat these patients. In the community setting, MERS is not highly transmissible. However, there is concern that when the patient is receiving health care, there is risk to the healthcare workers.
The hospital is taking precautions to protect staff. The patient is listed in stable condition but requires oxygen support. The CDC says at this time there is no significant risk for the virus to